Good morning and welcome, folks. We're going to give it just a few more minutes as we've got a couple more people joining us now. It's great to see everybody. Well, good morning and welcome to our virtual Winter Buzz breakfast. Of course, it's BYOB, that's bring your own breakfast. Sorry we can't meet in person. It'd be good to see everybody and get to mingle. But given the circumstances, I'm glad we're still able to meet. My name's Ed Manning. I'm the Executive Director for Leadership Asheville, and we are so glad you could join us today. Leadership Asheville is a part of the University of North Carolina at Asheville, part of the Office of Community Engagement. We exist to build collaborative leadership capacity and foster an equitable, inclusive, and sustainable community. To do that, we offer a number of programs and services that promote collaborative leadership and civic responsibility. We are extremely grateful to our presenting sponsor, the Van Winkle Law Firm. The Van Winkle Law Firm support allowed us to expand our traditional Summer Buzz breakfast series to include this winter series. And at this time, I'd like to ask our Mayor, Esther Manheimer, a principal with the Van Winkle Law Firm, to say a few words of welcome. Mayor Manheimer. Welcome.
Hi. Wow. Thank you. Thank you, Ed. See, there's already 150 people on. I'm really impressed. That's probably pretty good attendance for one of these breakfasts. It's the Van Winkle Law Firm's honor to be a sponsor. Of course, this was not quite how we envisioned this last breakfast. This is working. First of all, I just want to give a big thank you to all of you in our community who are working hard to keep working while you're staying home and staying safe and turned into homeschooling parents and incredible gourmet chef and else. And I also want to thank our panelists today, as I understand it, Stephanie Brown and Kit Kramer and Dr. Jennifer Mullendor, for doing an amazing job during this crisis. All three of these women have stepped up big to help shepherd us through this time, each in their own. And I really want to thank them a lot. They're responsible for me being on a lot of Zoom meetings and that, but I do really appreciate it, and our community appreciates it. So I'm excited to hear what they have to say today. And I just want to tell all of you who now we're up to 171 people, it looks like, who are, you guys are the people that think about how to solve problems in our community together. And now more than ever, we need thought leaders to put their heads together, solutions that will help us move through this crisis stronger at the end of it. So thank you.
Thank you, Esther. I really appreciate it. And I also want to recognize Libby Kyles is with us as well as a panelist. Looking forward, and thank you for all the hard work you're doing as well.
Thank you.
So again, thank you to the Van Winkle Law Firm for all your support for all the Winter Buzz breakfasts. I do want to thank our table sponsors, and I really appreciate the table sponsors because while you're not at a table, they have been really helpful in supporting the work we do. Our platinum table sponsors, Explore Asheville, Parsec Financial, Western Carolina, and UNC Asheville, really appreciate your help. Our gold sponsors, AB Tech, Asheville Housing Authority, and the City of Asheville, and our silver sponsors, First Bank and Home Trust Bank. thank you. I wish you were sitting together at your table. We'll get back to that soon, I hope. I also want to recognize and thank our sustaining partners who make a significant contribution to Leadership Asheville, and by doing so, they support the development of collaborative leadership throughout our region. Our sustaining sponsors are TD Bank, the Van Winkle Law Firm, and Waste Pro USA. Likewise, our community partners make a contribution, an in-kind contribution, and I want to thank 103.3 Asheville FM Radio, Blue Ridge Public Radio, the Crown Plaza Resort, even though we can't be there this morning, Gray Line Trolleys, and the YMCA Blue Ridge Assembly. Lastly, I want to thank our Buzz planning team. They're all Leadership 37 graduates, Mary Hall, Bruce Johnson, BJ Kilgore, and Eric Robinson. They've really done a fabulous job, folks. They not only worked hard to put together a fabulous program, and couldn't be a better topic in terms of Asheville's resilience, but I called them back in and said, hey, listen, we are not going to be able to hold the Buzz in person, so we've got to pivot and readjust. And they jumped right back in and put together this program we have for you this morning. So really, really appreciate their work and time and effort. So just a bit of housekeeping before we bring on our panelists. We are going to be using the Q&A function in Zoom for your questions, and we'll try to get to as many of those throughout the program as we can. We will also be recording the webinar, and we'll put a copy of the recording on our website at leadershipasheville.unca.edu. And so before we start, I do have a poll that I want to ask you to take part in. The two questions. First is, did you attend one or both of the previous Winter Buzz breakfasts? Yes or no? And are you able to continue to work at this time? And we get a few more answers on that, and I can share with you the results. Okay, folks, I'm going to end that poll. And just so you can see where we are. A lot of folks joining us the first time for the Winter Buzz. We do appreciate that. I'm glad you could make it this morning. And there are a number of folks that are still able to work. That's also good to hear. So as you may know, this year's planning team decided to focus on resilience, and they began planning that back last July, so really timely. In January, we looked at climate resilience and its impact on our community. In February, we focused on social resilience and really looked at the opioid crisis. And March, we were supposed to focus on economic resilience, specifically around housing. Well, today we want to continue that conversation on economic resilience, but as we're now in the midst of this major stressor, we want to talk about where are we now, how long might we be in recovery, and what can we do to help that recovery, to help everybody recover. To do that, we have 5 key leaders from our community to address these concerns. Join me in welcoming Stephanie Brown, President and CEO of Explore Asheville, Kit Kramer, President and CEO of Asheville Area Chamber of Commerce, Libby Kyles, CEO of YWCA of Asheville, and Dr. Jennifer Mullendore, Interim Health Director and Medical Director for Buncombe County. Moderating our panel today, as he did in the previous 2 Buzz breakfasts, is Jim Fox, the former Director for NEMAC and now Senior Resilience Associate for NEMAC and Fernleaf. Please, I'd love for you to applaud if you could. Join me in welcoming them to our panel. And Jim, with that, I'm going to turn it over to you.
All right, well, thank you, Ed. And I'm going to wait for you to allow me to share my screen.
And I'm looking for you to spotlight you as well. I think
okay. Well, as we're getting this technology to work, good morning, everybody. And it looked like from the poll that several of you did not attend the previous one. So we will give a quick review of resilience here. But as we're getting ready to do that, thank all of you for being here. It is the community of leaders that Leadership Asheville represents that takes what it's going to take for us all to move forward in this. And so it looks like we've got this working now, and I am going to all right, looks like we're up and running here. So, you know, as we talk about resilience, we really look at, you know, where we live, Asheville. It's a great place to live and work. And if we start really defining that in a graph here, you can see that the graph on the vertical side has what we call community capacity. And across the bottom is time. And we all expect, as we live here, that a certain level of quality of life, you know, a safe place, healthy opportunity for all exists. But, you know, when a threat occurs, just as we're experiencing right now, that we get dropped off of that line. And the question that we try to address is, well, how far off of that line have we dropped? And how long is it going to take us to get back to, you know, that level playing field that we, you know, we all appreciate for Asheville being the great place to live and work. Well, in the past, you know, threats that we've dealt with, we kind of know about those and, you know, how we can actually bounce back. You know, we had the flooding in 2004, we had the I-40 rock slide in 2009, some more flooding and landslides in 2018. And, you know, we've been able to be resilient and bounce back from those. The key point I want to point out here, though, that when we start looking at the impact on our community, at least one way that we judge that is over half the cost are due to business interruption. That when we looked at the flooding in 2004, 200 million impact, that over half of those were business interruption. And when we then look about, well, how can we actually, you know, bounce back and how do we build resilience? We look at this concept of what can we be investing in now so that when future hazards do occur that we don't get dropped below a critical threshold. And the discussion that we're going to be having today is, you know, with the pandemic, you know, where are we and how does that look for our community? You know, where are we on this curve? You know, have we reached the bottom? You know, how far has that dropped? And, you know, what does it look like for getting back to, you know, life as we experienced it before the pandemic? Well, with the panelists that we have, we also realize that you can't look at this just as a single curve, that we have this set of things going on. And, you know, from a health perspective, been very proactive in Buncombe County. And, you know, how far have we dropped sitting through there? And, you know, are we bouncing back where we at on that curve? We all know the very large impact on tourism in our city and all the people's lives and livelihoods that are being impacted by that as well too. So we'll talk about that next. But, you know, when we look at tourism, tourism is part of the general economy. And, you know, how big a piece is that and what does that look like for, you know, our region sitting through here? And of course, then we have to look at all of us socially as people sitting through here and what is the social impact? And, you know, that's where, you know, Libby can be addressing some of that for us as well, too. So, you know, we know that these curves are linked. And so we start taking actions to start bouncing back, we're going to be prioritizing our values, and we've seen that very well. And I think we're all very proud of the fact that as a community, we're used to working together, and we're seeing that through here as well too. And we prioritize on things we care about, our values, right? And just voting by doing, we can see things like health and the economy and tourism are these things that we value. And so we wanted the panelists to really be talking about each of these things from their perspective and how do they all fit together. And as we start taking action, what are the different options that are available to us? We can talk about a gradual opening and, what do the curves look like for that? But we've also been having the discussion in our community that if we have too rapid of opening and we would experience a second wave, what would that look like as well too? And so these are the choices that are facing us and facing other communities across our nation. And so it's great for Leadership Asheville to bring this group together to be able to discuss this and to be able to open it up for questions and answers as well too. So with that, I'd really like to open this up to the panel. These are the people that you came to hear this morning. So I'm going to stop, but we're going to start our discussion this morning with Dr. Jennifer Mullendore. And she's got some slides here that we're going to share for her as well too. Would like each panelist to talk about, their sector, their view of what's going on through here. And then as we get through each presentation, then we're also going to come back together and look at, how does that fit into the larger system as well too. So with that, I am going to turn it over to Jennifer. And Jennifer, just tell me when you want me to advance the slides.
All right, thank you, Jim. So good morning, everybody. So I'm gonna start out by just sort of covering information that I share routinely in our media briefings, community updates regarding the data. So you can go on to the next slide, Jim. This is information that is available on the Buncombe County website. So if you go to buncombecounty.org, at the top of the page, you'll see a banner for COVID-19. And when you click that banner, it takes you to all the information about COVID-19 on the county website. And at the top, we now have information on our daily case count, fatality count, and demographic information about the cases. And so this is the screenshot from yesterday. In terms of updates I have since this was posted and since my media briefing, only update I'm aware of at this moment is that we did have another fatality yesterday afternoon of one of the cases we had already reported. So we have 54 lab confirmed cases in Buncombe County and 4 COVID-related deaths. We are modeling this demographic information on how the state is presenting their demographic information on their website. So the age ranges are the same, and we're trying to use all the same categories that they're using so that it's more comparable. And then you can go to the next slide, Jim. This is information, so the News and Observer has, I like this map. I think it's more easy to read in terms of the color coding. And so it's on their website, and Dogwood Health Trust has pulled some of these maps into their website as well, but this shows you the entire state. The darker the color, the higher the number of cases. And so how do we compare as a county with other counties in the region and with the state overall? Well, you can see the western part of the state in general doesn't have the same density of cases as other parts of the state. In Buncombe County, again, we're at 54. Our neighbors to the south in Henderson have significantly more cases, and a lot of that is tied to their outbreaks that they've had in long-term care facilities and assisted living facilities. Almost 81% of their cases have been associated with this those types of outbreaks. And it really only takes one of those outbreaks to increase your case count significantly. As we know, that's a very, when we're talking about nursing homes, skilled nursing facilities, assisted living facilities, those tend to be much more vulnerable populations who are, it's just easier for that illness to spread and have pretty devastating outcomes potentially. The majority of cases are concentrated around high population areas like Mecklenburg, those counties. And that's kind of where the infection was first noted as well. I would say that and I think Dogwood on their website is capturing some of the cases that don't count within your county. So for surveillance purposes, as a county, cases are counted if they're county residents, right? And if you remember early on in our experience with COVID-19, our first round of cases, we had many travelers. 5 travelers over the early weeks of the outbreak, and so those don't count. Those don't show up on the statistics for the county cases, but it is work on the part of the county health departments to investigate those cases along with the county of residence for that individual. So the numbers, some of the western counties might have higher numbers of cases they've been investigating, but those don't show up on the map because they might have been residents of Georgia or South Carolina. So know that these numbers are just a snapshot of people who live within those counties. When you go to the next slide, it shows the deaths. And again, ours will change later today on the map. But you can see some counties, again, significant death tolls, often related to outbreaks in long-term care facilities. And so again, in the region, Henderson County has 14 deaths because of all their outbreaks with the long-term care facilities. When you go to the next slide, this is from MAHEC. They have a regional response dashboard. And so they were able to capture the number of confirmed cases per 1,000 individuals from different areas around in the region, I would say, in the Mid-Atlantic region. And you can see down at the bottom, Western North Carolina has a much lower number of cases per 1,000. And I think, a lot of the actions that we took as a county and as a state had an impact on that. And we're interested to see, as we know, over the weekend, several of our neighboring states relaxed back their restrictions, which gives us a lot of pause and makes us worried about what that will mean for them, and then potentially for us if there are individuals who travel from those areas or to those areas and back. But aggressive physical distancing is key at this early stage to controlling the spread of the virus. And so, we as a county, once we felt like it was time to take action, we did that in the state soon after. So, we haven't seen significant numbers of people getting sick at the same time, overwhelming our healthcare system. Our hospitals haven't seen the surge and have been able to care for those who have become seriously ill. And so that's all good news. As a region, as a county, and as a state, we've been able to flatten the curve, as the saying is, and really slow the rate of acceleration. And so we feel good about that, but we acknowledge that came at a cost. While it has saved lives, we know that there is cost to it in other ways in terms of, you know, financial costs, economic costs, social, mental health. Like there is definite impact, and we acknowledge that. But you know, we had to make sure that we were protecting the public's health. And so if you go to the next slide, if you saw the media briefing I think it was last Thursday, that the governor and Secretary Cohen from North Carolina DHHS gave, I thought it was a really very good summary of what do we need to do as a state to ease back on our restrictions. And so they broke it into 3 categories: testing, tracing, which is contact tracing, and trends. And they, you know, the point is that science and data will guide how we slowly, gradually lift restrictions, and that's important, right? Science and data need to be the backbone of that. And so the state now has a dashboard that shows on the dashboard they added data on these metrics that they're following to look at, you know, what is the status of COVID-19 in the communities, how many people are seeking care at emergency departments, how many lab confirmed cases have we had, how many positive tests as a percentage of the overall number of tests, how many hospitalizations. They're tracking the supply of personal protective equipment, the number of tests that are being done today, how much support is there for contact tracing. And as a county, we're looking at that information too, and hopefully we'll add that information to build our own dashboard that will look more at the local level. In terms of these things, so testing, you know, the guidance has changed frequently for healthcare providers throughout this outbreak, in terms of who do you test. And so we are now in a world where if a provider suspects COVID-19, they are encouraged to test. And so I've been in communication, and my staff have been in communication with local providers who have maybe have been testing throughout, but are ramping it up now in order to test more people. They need to have adequate PPE, personal protective equipment, in order to do this testing. And so we're working with our emergency services individuals to support them in that. We've reached out to our federally qualified health centers and are trying to get testing out into communities, under-resourced communities, where they might not have primary care providers or lack transportation to get to clinics, and where we know that more vulnerable populations live. So we're working with our community partners to expand testing in our area. At this point, a rough estimate is around 2,200 tests have been done in the county, and that is going to be an underestimate. Not everybody has to report or has reported tests that turned out to be negative, and that doesn't account for in-house testing at Mission Hospital that they're doing on the inpatients. In terms of contact tracing, we have staff who are, every case, we are identifying close contacts, reaching out to them. If we identify symptomatic contacts, we're getting them connected to testing. And so we're able to manage the capacity at this time. As testing increases, we expect cases to increase. And so we have additional staff that are ready to be trained to fill in any, to help support additional tracing. And then trends, like I talked about, we'll be monitoring that data. And then again, the governor laid out the phases for, you know, what we are considering as a plan for easing restrictions, what's called an adaptive response. You look at the data, you scale back a little bit, you watch the data for a couple more weeks, you scale back a little bit more, in order to make sure that we don't see a huge surge and have to go back all the way to the beginning and redo all this hard work with physical distancing that we've done as a community and as a state. So I'm going to stop there.
Well, yeah, thank you, Dr. Molander. Really appreciate that. We will be keeping track of the questions that people are submitting, and once each of our panelists have an opportunity to talk, then we'll start handling those in the Q&A. Next on our panel is Stephanie Brown, CEO and President of Explore Asheville. And I'm going to stop sharing my screen and we'll listen to Stephanie talk about her sector.
Hi, thanks, Jim, and thanks to Leadership Asheville for inviting me to be on the panel today, and to all of you for spending part of your morning with us in this kind of what is our new and hopefully fairly temporary normal. You know, from a tourism perspective, they're estimating that the national impact of the COVID-19 crisis will be about 7 times the total impact of 9/11. I think that locally, it's even greater than that for Asheville, because the impact of 9/11 for Asheville was much less than it was, you know, in some of our more populated areas. You know, I was in Washington, D.C. at the time, and 9/11 essentially, you know, shut down tourism similarly, but Asheville didn't have that same effect. And in April, visitor spending is about 7.5% of annual visitor spending. And so we can pretty reasonably estimate that just in the month of April, we lost about $152 million of visitor spending to local businesses. And, you know, clearly the duration of this will extend through May. And so it's a fairly reasonable assumption that more than $300 million of spending by people who visit Asheville is lost from the cash registers of local businesses. And of course, that flows into personal incomes in tips and wages. You know, this comes at a pretty difficult time of year, especially for tourism businesses, because, you know, although we're less of a seasonal destination than Asheville had been in the past, this is a time period where businesses that serve visitors have come out of the challenging months already. And, you know, this really came just at the beginning of the spring travel season. We suspended paid advertising at Explore Asheville on March 11th, before the emergency declaration. We had just finished the Southern Conference basketball tournament, and, you know, over that weekend, the health advice was to wash your hands. And our team got promotional information out to hotels for guests who are checking in to promote these sanitation recommendations. And really within just a couple of days, it became obvious that the extent of this crisis was going to be really far-reaching. And so we moved quickly to stop all of our advertising, all of our promotion that invite visitors to the community. So, you know, that $300 million that we can expect has been lost from visitor spending is really just from visitors. That doesn't count the spending by locals at these same businesses. Visitor spending accounts for about half of all of the food and beverage receipts in Buncombe County. It's about 20% of retail. But let's not forget, you know, the vast number of businesses and organizations in the arts and entertainment and recreation and venues and artists, and you know, the visitor economy affects such a wide range of businesses. We serve about 1,300 local businesses to connect them with visitors, and about 18,000 local jobs depend on visitor spending to survive. So, you know, of course, you know, the duration of this crisis is still relatively unknown, although, you know, we're progressing to a point. I'd like to say how much we appreciate the leadership and collaboration of our public health officials, and, you know, the decision of when we can resume advertising and stimulate that spending back into the economy will be a public health decision. And, you know, we look forward to making that decision in collaboration with public health officials and elected leaders. I think that'll be one of the more difficult, you know, decisions that we face. In the interim, Explore Asheville has pivoted to provide different kinds of support to local tourism partner businesses. We have curated a resources page on AshevilleCVB.com that includes helpful sources of financial relief and information. We've been working with lodging partners to convene, I think, 3 webinars so far on compliance with the emergency declarations and to make sure that they're safely operating for only essential visitors. We also have created a new website. I invite you to look at exploreasheville.com. Now has a virtual vacation section, but also it highlights online shopping. So if you're looking for a place for a Mother's Day gift and you want to shop local, there's a handy reference to all of our local retailers who are offering online shopping, takeout and carry out to help support those what are now minimal operations for Asheville area restaurants. But there are also a lot of really creative efforts going on for, doing yoga at home and, virtual concerts. And my birthday was just recently, and I received a singing telegram by a local musician. And so this website helps to support all of those efforts, all of those creative efforts, and also it is a hub for community support efforts. So if you're looking for a place where you can go to provide virtual tips or make contributions to a host of different efforts, that's a good place to start. So we don't know the duration of this crisis, but we can look to precedents for how Asheville might recover. Asheville has been a pretty resilient economy. As I mentioned before, the effects of 9/11 were less here for a number of different reasons. We also were able to come out of the recession more quickly than many other places. And in part, this was because of a source of advertising funding to be able to attract customers into our community to support local businesses and generate that spending through not only those businesses that serve those visitors, but also the ripple effects into the economy, into accounting and business services and banking and insurance and graphic designers, and the list really goes on and on. And so I think we can look to that precedence to understand that we do have some tools in our local economy toolbox to help bring visitor spending back in as soon as it's appropriate. And we're dedicated to a strong and fast recovery. So, thank you, Jim.
Great, thank you, Stephanie. And for everybody that's participating, keep submitting the questions. We will be looking at those. I think one question that's already come up is actually a great way to move from Stephanie to Kit. And that's really talking about, the diversification of our economy and how diverse is the economy and how do we, actually look at that equation. So it's my great pleasure to introduce Kit Kramer, President and CEO of the Asheville Area Chamber of Commerce, to talk about, our regional economy and where we're at. And Kit, as you start talking, just let me know when you want me to share your slide as well, too. And I think you're muted still.
Yeah, I just realized that. I've been doing quite a few of these types of things. You'd think I would just do that automatically, but thanks for inviting me to be here today. We're actually competing with a town hall that the Chamber is conducting with Buncombe County right now with business owners for arts and entertainment industries. And it's we found ourselves shifting through this entire process. When we started off, I too want to thank not just the health department, but local government in particular for the level of collaboration. When we were having a discussion about what are the lessons to be learned from this process, I think that collaboration has been incredibly strong. Stephanie and I have participated in at first 3 weeks at least, it was a daily conversation with local government with a group of business people, and focusing in on how we can help business deal with closures, get the best information out to everyone. And we've seen stages. I mean, we've had interpretation of orders that have had to be given. We've talked with our folks. We've made available a lot of people to talk about how a business can pivot and still remain viable. Interpretation of loan information and relief information is something that we focused on. And now we're focused on reopening. So this week, we're actually having 9 town halls with business owners. We started yesterday. Libby Kyles is on this call, and we're starting with childcare because it's one of the pieces of critical infrastructure to allow people to get back to work when the time is right, when the time is safe. And then we went to healthcare, which is our largest employer. It's frequently, the word has been that tourism is the dominant industry. Jim, if you want to show that chart, let's talk about that. There is no doubt tourism is an important industry for us in the Asheville and Buncombe County area, in fact, in the regional area. But I want you to look at this, and I've gotten trashed before in terms of some of these categories. I want you to understand where the labels come from. So for example, leisure and hospitality includes, so leisure and hospitality is this orange section, 14%. But I want you to look at the other areas as well. So the orange section is 14%. It includes arts, entertainment, recreation, accommodation, and food services. So we have healthcare. We actually started with a town hall yesterday on healthcare because the official category is health services and education. I didn't make that up. That's from the Bureau of Labor Statistics. And actually 91% of that blue section, the 20%, is related to healthcare. The other 9% is education services. There are NAICS codes that are used to classify different levels of industry. So you can see we're better balanced than a lot of people realized. So the questions about diversity in the economy, I agree. I mean, it's kind of like, it's not having all your eggs in one basket. It makes complete and total sense to me. You can, I think we're done with that chart now. Thank you, Jim. So now we're focused on reopening, and it's going to take just an incredible level of flexibility, being nimble, and trying to figure our way out of this particular situation. And we're trying to find best practices and bringing those to bear. One of the advantages that we've got in Asheville is the level of creativity of its people, the level of entrepreneurship. I mean, entrepreneurs are sturdy people in many ways. You don't go into business unless you've got some courage and some guts. And all of that's going to be required, as well as some of the relief programs that have been announced. I'm hoping that Stephanie will talk more later about the proposal from Senator Chuck Edwards about providing the $5 million from the Tourism Product Development Fund for the tourism industry. I think that is incredibly important, because those dollars need to come back in to help us restart those small businesses that we all love. I mean, and also, if I were talking about diversity, I'd talk about the size of business as well, not just industry. But we love those small businesses. They are what make Asheville a very unique place. But the problem with small business in some cases is they may not have as deep a bench in terms of capital that can be used. But you've got an individual who may wear multiple hats. There may not be HR people who can bone up on the best cleaning mechanisms and the best distancing mechanisms. You've got a person who is responsible for all of those things. So providing support for those people is going to help us bring back this economy, but also ensuring that we keep a broad array of business in this community. Manufacturing is one that pays higher than average wages, and we've had wage concerns. We know that there are aspects, people in this community who have not experienced the same level of success in the previously strong economy, and those issues need to continue to be addressed in order for everybody to benefit. So even though some of those fundamentals are not going to go away and should not go away, because those fundamentals will make the difference in building a stronger overall economy in the future. Diversification absolutely needs to continue to be one of those issues. I lived downtown for many years, and I've heard people talk about how sad it is that downtown is so empty right now, that it looks like a ghost town. Well, actually, I view that as a positive sign, and I give a lot of credit to everybody for joining in and abiding by the rules that have kept our numbers as low as they are. I was talking with Dr. Mullendor, and she said, you know, in some cases, we've just gotten really lucky. We've got some retirement communities here that have not been impacted, and as has Hendersonville, for example. So we're very lucky, but I also think people have tried to work hard to stay safe, to do the right things, to be socially responsible. And I want to tip my hat to everybody who has taken those very painful steps. So I think now we've got to turn to being creative and to learning as much as we can, to not waiting for people to help us figure out how to restart our businesses, but to begin to dig in to best practices and to get as much information as we can about how we can go about safely reopening. It's not going to be a situation where there's going to ever be enough testing or thermal thermometers and things of that nature. Part of it is just going to be, we're going to have to go back to some of those fundamentals that we've learned in this process, which is social distancing and good sanitation, good personal health habits. All of those things are going to have to be abided by in order for us to reopen. So the sooner we can start, and the sooner we can get money flowing through this economy, the better off we're going to be. That's why we started with childcare and healthcare yesterday. We're focusing in on the restaurant, lodging, entertainment industry, manufacturing as well, has already been sharing best practices amongst manufacturers. We're going to be doing professional services and personal services. When you talk about small businesses, personal services are big on those. I am dying to get a haircut. As I know so many people are, I've been hoarding my skunk stripe color to get me through this situation. But more importantly, those are the livelihoods of individuals. I also want to thank everybody. We've been working through the One Buncombe program. I looked at our numbers this morning. We're at $1,180,504 have been contributed by 865 donors. And our goal has shifted from getting over $1 million, which we thank everybody for helping us do. But we now need to move to, we want to give 100 loans through Mountain BizWorks to small businesses that have very favorable terms. And we want to help 1,000 of our neighbors who lost their jobs through no fault of their own during this process. So I would encourage you to continue, if you've got the wherewithal at all. Any size donation to onebunkum.org would be helpful in achieving that particular goal. And I want to thank again our partners in local government in helping us get through this process. That level of collaboration is another key asset of Asheville, and we've got to continue working not just between government and the private sector, but amongst the nonprofits. I've seen levels of collaboration that have been amazing and absolutely essential in helping us rebuild the economy.
Thank you very much, Kit. I would like to take this opportunity now to introduce the final member of our panel, and that's Libby Kyle, CEO of YWCA of Asheville. So Libby, please share with us your views on resilience.
Good morning. I first want to say thank you all for being here. I also want to thank Asheville City and Buncombe County for their quick reactions and all the collaborative nature and things that have been happening in terms of getting people the things that they need, and masks, and particularly in childcare. It's been really amazing to see how everyone has pulled together to make sure that we have what we need at this critical time. As we're talking about this idea of recovery, I want to touch on some things that a little bit more social, not so much about the business end, but thinking about our communities and the people within our communities. I think that it's important that as we start having conversations about recovery, that we keep the health and welfare of working people and communities as a top priority. And what that looks like is several different things. There are many people right now who are struggling to pay rent. What does it look like when the courts reopen and they can start to process evictions? What are we going to be doing then? What is the city and the county going to do to ensure that people remain housed and that our homeless population does not grow because of this pandemic? When we think about the fact that most of our most critical people, our grocery store workers, a lot of those folks are not making a living wage. What do we do? How do we support them? Have we instituted hazard pay for all of those workers? What are the things that we've done to really shore up those people who have, in essence, been on the front line for all of us, making sure that we have food, making sure that the healthcare system is able to continue on. People talk about doctors and nurses. Well, you also need CNAs. You need janitors. You need all those people. And so what does recovery look like with those folks? The mental health side of things. You may hear some girls in the background because I'm not just CEO of the YWCA, I'm mommy. And so we have school this morning, and I'll share with you that one of my girls right now worries about her own health and whether or not she's going to get sick. We got to think about the mental health toll that it takes, not just on adults, but on our children. And what does school look like for them in the fall if we're able to open? And what support systems are we going to be able to put in place to make sure that teachers, students have what they need to cope with this situation beyond the immediate crisis? That's what resiliency is. It's going beyond that immediate crisis and to see what the long-term effect is going to be. I think it's very important that we highlight those communities. The community of African Americans in Asheville is 11.9%, 12%, and Hispanic is 5.6%. We know by state statistics, we know by national statistics, that those two communities are the communities most impacted in terms of health and death statistics by COVID-19. So when we look at our numbers in Buncombe County and we see that 51% have been white, and only 50 cases have been white and 2 have been African American. The reality in that number is that there's a disparity in the testing. And so we need to make sure that as we talk about recovery, we look responsibly at the things that we put out. And Dr. Mellendorf, that's not to you personally. I just want to kind of highlight that there is a difference in the statistic that we see here in Buncombe County, what the state shows and what the country shows. And so we need to make sure that we have a really concerted effort in getting more testing in public housing spaces, getting more testing amongst the homeless people. One of the reasons I think that number is so lopsided is because we have not had the amount of testing that needs to happen in order for us to truly assess the effects of COVID-19 in the Latinx and African American communities within Asheville. In terms of thinking about recovery, again, I love hearing Kit talk about all the meetings that are happening and all the collaboration that's happening with the city and the county and with businesses. All those things are amazing. Another amazing thing would be to make sure that we bring people from community in on these conversations about recovery, in on the conversations about what are our next steps. Because honestly, those people in community, working poor is what I'm going to highlight. Those people have always been resilient, and I say those people, I'm one of those people, have always been resilient and has always been able to bounce back. And if we expand our line of thinking to include those people who are in groups, our people, that have traditionally had to be resilient throughout our country and throughout our history, we might learn some different strategies and some different ways of doing things that could help us to bounce back a little bit more. I just think it's very important that as we have these conversations, we don't just focus on business and economy, but we really focus on the human impact in our communities of color. So dealing with this whole economic issue, what do we do also for those people who may not have been working before this crisis hit for whatever reason? How do we expand the education in Asheville so that we are getting people prepared for working in different types of scenarios, right? So what industries are going to be coming to Asheville, and how can we prepare the people that are already here to work in those industries, but beyond hospitality? People in poor communities should not only have the option of working in hotels and restaurants. So what can we do as a city, as a county, to put programs in place so that we can prepare people to be technologically savvy and be prepared for all the other things that are going to be coming to Asheville? Asheville is an amazing place, my home, and I am very appreciative of the way that people are coming together. I would like to see us be more collaborative in bringing in, and I don't quite know how to describe the word, I would say community level folks who work on the ground on a day-to-day basis with those communities that are most impacted by not just COVID-19, but other disparities that exist within our community. The one thing COVID-19 has done, it has truly exacerbated that there are disparities amongst race and class, not just in Buncombe County, but across our nation. And so as we think about recovery, how is recovery going to be equitable for all of our citizens? Thanks.
Wow, thank you very much, Libby, for that part to remind us the social and the equity side, because I think that, you know, when we look at this entire equation that all of us are talking about, it's how do we all bounce back? How do we all recover? How do we all get to that line that really represents Asheville for all of us as well, too? There's been questions and answers, you know, starting to be provided. So I'd really like to start going down some of those questions. I think one of the questions deals with the need to be scaling, you know, leadership across all the different entities, and how do we make sure that this collaboration is working not just within the city, but the region and the state and all as well too. So is there a member of our panel that wants to start addressing that question? Yeah, Kit, why don't you go for it?
Well, we've been trying to build relationships throughout the region because we are the center of a regional economy. We've been trying to build those relationships for years, literally. And we were formalizing that before COVID threw us off track by bringing together a group of business leaders as well as staff from local government, as well as some elected leaders together to talk about how we could, those key pieces of infrastructure we need to work together on. If everybody is going to do well in terms of a recovery, we've got to have the infrastructure in place. And that relates to everything from education to highways to power infrastructure, water, things of that nature. There are already entities that are working on those particular pieces, but our thought was that when you bring business to the table to speak directly to it, some of the politics fall away a bit. And some of the business doesn't really care about the lines. They care about getting their customers what they need, and they exist all over the region, and they don't really care about the lines. So we thought it would be helpful to have those folks at the table to talk through issues. But what we have to do first, before you can begin to make tracks in terms of those types of infrastructure issues, you have to develop a relationship and a sense of trust. And there's some deep-seated issues in this whole neck of the woods that are, I mean, for somebody who's been here 10 years, I was really surprised at some of the depth of feeling about some of the things that have happened in history. And so we got to develop a relationship. We're hopeful we can get back to that quite soon because, and we've been collaborating with folks throughout the region on some of our surveys and things that we've done, so we have a better and more complete picture of what's going on economically from a business perspective. And I want to mention, I didn't do this originally, but we've got a second survey out, and we're going to be using the information from that second survey to communicate with decision makers around the region, but also with our General Assembly members. If you go to ashevillechamber.org/coronavirus, you'll see right near the top survey number 2, and I would urge you to fill it out so that we can collect that information. We'll share it with all our partners throughout the community as well as local government, but we'll also share it with General Assembly members. So thanks for
Okay, does anybody else on the panel want to address that question as well too? All right, there's a couple other questions here that are talking about you know, how fast we might be able to bounce back, and are we going to be able to bounce back to where we were before? Does anybody want to start talking about that one?
Well, I'll take this opportunity to also make an announcement that is, you know, related to our ability to bounce back, both, you know, economically and, you know, also as a place that, you know, is that we've all loved living in. I guess it was just yesterday. There was an announcement Friday. There was an announcement that Senator Edwards is introducing legislation today that would create the Buncombe County Tourism Jobs Recovery Fund. And we're really excited about the potential of this because, you know, there are loans available and all kinds of programs, but we haven't seen a grant program that would provide grants that don't have to be repaid back, with the purpose of helping our local independent businesses to reopen. You know, after months of being closed and, you know, being shut off from revenue and access to capital. I think one of the things that will really, really affect a lot of our ability to bounce back, is whether these businesses can survive. Like Kit said, these businesses that we love so much, we love them because they're locally owned and they're independent and they're unique. But that very nature of that makes it much harder to survive a crisis like this, especially at this time of year and for the duration that it is. And so the funding for this grant program, $5 million, is the reallocation of money that was collected from people who visited and stayed in our paid lodging. So it's occupancy tax dollars that were collected for the purpose of tourism product development. And it's really important to understand that, after a tax has been collected, it cannot be redirected. According to the North Carolina Constitution, tax money has to be used for the purpose that it was collected. And so there was an opportunity to maintain the purpose of this tax revenue, which is tourism product development, but just change the idea of how it gets allocated. Typically, this fund was created in 2001. And it's provided about $43 million worth of funding for community assets like museums and greenways and sports facilities and lots of infrastructure, including about $7 million of infrastructure in the River Arts District. And so we'll continue to use it for product, for local businesses, things that visitors experience. But the way it's allocated will be different. It will be administered through a third party with expertise in coordinating financial resources in response to emergency situations. And, we still believe very strongly in partnering with municipal governments to provide infrastructure that supports quality of life and future investments in visitation. And we'll get back to that mission right away with future revenue. We're just finishing our tourism management planning process, and we're looking towards being able to support bonds and pretty significant investments in infrastructure. But for right now, the pressing need is capital and revenue to reopen these independent businesses, and the mechanism that was available to do that was the allocation of funds that were collected for the Tourism Product Development Fund. And I'd like to just thank Senator Edwards for, getting a bill through this session, a local bill in, a session that's supposed to last for just a few days, is a mighty hard thing to even attempt. And so Senator Edwards, with the support of our local delegation, is, taking on this task, and, we're really hopeful that it will pass the General Assembly, who's dealing with so many priorities this week.
Great, thank you very much, Stephanie. Dr. Mullendorf, there are several different questions about the testing. One of them is, does Buncombe County currently have the resources to perform the necessary contact tracing, or will this be done at the state level? Do you want to talk about some of your resources for testing and tracing?
So to start with the contact tracing question, so yeah, we currently have capacity. That's the job of our communicable disease nurses. And so we have 7 staff currently who, when there is a case of COVID, a lab confirmed case identified, they speak with the individual, determine all their close contacts, reach out to those close contacts. And so they currently have capacity, and then we have school nurses and other staff who are waiting in the wings should we need to their assistance. The state has, yesterday they rolled out a plan for increasing the number of contact tracers across the state, and there's a website with CCW&T CommuniCare North Carolina is helping to organize that. There's a website where people can go online and apply, and then it will be more of a model of, if a health department feels they need additional support, they'll reach out and request contact tracers to be assigned to their department, and then when they no longer need them, they'll return them back to the pool. So right now we're fine. It all depends on how many cases are identified in the coming weeks, if we're able to continue to meet that load with our internal staff. With regards to testing, I'm seeing some of the questions too. So let me go back up here. Testing, all right. In terms of the types of testing or what we're looking at, yeah, so we're working with, we're working with Western North Carolina Community Health Services, Appalachian Mountain Community Health Centers. We had a conversation with them last week. They're giving us their proposals essentially today, in fact, where ideas of what they might need to get community testing out into communities. And so when we say communities, we mean getting them out into housing authority properties, getting them out to more rural areas like Sandy Mush, getting them into areas where we know we have under-resourced areas where people might not have the ability to get to the provider, might not have health insurance. And so that's the goal for them to help us get out into the community, with the county supporting, like providing vehicle, providing whatever they need to get it out. And we're working with our community engagement, Buncombe County community engagement staff, who have relation with these communities and to help make sure that people feel comfortable taking, I guess, to take advantage of this opportunity. In terms of testing, so testing right now, we're hearing from labs like LabCorp and Quest and other commercial labs. They have capacity to take on additional specimens and run the tests. And testing at this point is still focused on symptomatic individuals. So the CDC did expand their symptomatology of COVID-19. So, traditionally it's been cough, fever, shortness of breath. Yesterday they added in things that, that we have seen locally, chills, headaches, sore throat, loss of smell, loss of taste. So the direction to providers has been, if you suspect COVID, test for it. And so we're trying to it's shifting that gear, right? Where we switched from don't test unless high priority, high risk individual, stay at home, isolate. Now we're sort of saying, going a different direction, which is test these people so we know what's going on. We have to ramp up testing significantly across the state in order to be able to ease back on restrictions. So, I mean, we need to be doing hundreds of tests in Buncombe County a day, and we are not there yet. And so I'm trying to, again, push providers to do more testing, help them connect to resources that can help them do more testing, and then get the testing to where people with symptoms are, or people who are most at risk. And so we are working with partners on that. In terms of the testing, it is not serology testing. So there is so much out there about tests. What I would say is the testing we're focused on at this point is PCR, molecular testing, which tells you, does the person who has symptoms have COVID-19 now, or do they not? Serology testing is still not where we want it to be. This is a new illness, and so it's going to take time to get to make sure that the tests are valid. And so we don't know at this point. There are a lot of unanswered questions about COVID-19. Like, do people actually develop immunity after they recover? We don't know the answer to that yet. Is the response, if they do develop an immune response, is it strong enough to protect them from reinfection? We don't know that yet. How long does immunity last if people get immune? We don't know. There's so much unknown. And so while I know that there's a lot of media out there about serology tests, and we see states and we see countries really investing in these immunity passports, we don't have the science yet to say that this is the way to go. So our job right now is to identify people who have COVID-19 in this moment, and make sure that they are able to take care of themselves appropriately, and that we're able to identify all their close contacts so that we can try to contain the spread still, right? That's where we're at right now. I want us to get to a place where people can get tested, and see if they were exposed and have immunity, but the science isn't there yet. And then in terms of testing percentage as a total of the population, so there's, again, this outbreak has shown a light on many things, right? And so one of those many things is the lack of, like, our healthcare system, and how there are just so many issues with how our healthcare system works or doesn't work, and how we get data. And so I was on a call with some large and highly affected counties in the state yesterday, and it's hard for any county to really know how many tests have been done in their county. The systems we currently have to track things aren't able to get us accurate, totally accurate information. So we're trying to have to piecemeal things together. And so the test, I said the number of like 2,200 is a rough estimate. More have been done, but I don't, it's not going to be significantly more. I think it's a pretty good estimate. And that's of people, residents of Buncombe County who were tested and by Buncombe County providers. That's what that number is. And it compared, I heard from other counties that were slightly bigger than us that their tests were maybe a little less than ours. So I think we're pretty comparable to other counties, large counties in the state, except, the Wakes and the Mecklenburgs who've had, huge outbreaks going on.
Great. Thank you very much. I think the rest of the panelists have been looking at some of the questions that have been coming up as well too. Is there one of the questions that are out there that one of the panelists feel like they want to address? We're starting to run short of time, but I want the panelists to look at those and say if there's one that they've got energy around to be able to answer as well too. Okay. Ed, I'm going to also turn this back over to you a little bit. We do have quite a few questions coming in. Is our leadership Asheville going to try to answer some of these questions, or at least connect these questions to some of the panelists for follow-up with emails later or something?
We will try and do some research and talk to different folks in the community and try and find a way to answer these questions. They may also be questions we use for future virtual Buzz breakfasts and be able to answer some of those at a future date. We're planning to continue doing these kinds of events, hopefully every 2 weeks or so. We'll lock down dates as soon as we can. We're looking at May 14th for our next one. Again, the recording will be available on the website after this program is over, and of course it takes time to download and put it on the website, but it will be at leadershipasheville.umca.edu. So yeah, we will try and do that. Stephanie?
Oh, I'm sorry, I misunderstood how the chat was working, and I answered some things that I think are not visible to everyone. So
correct.
Just some more details around the Job Recovery Fund. One question is, sort of on the development path and the consensus around this fund. I think it's safe to say that the desire to create a source of funding that meet this needs was very widespread among community leaders, both elected and in the business community. I think it's important to understand that these are funds that were collected from hotels that have also been extremely hard hit, and to even have this conversation with community leaders who themselves are, have their businesses closed and are facing, potential, bankruptcy and dire consequences, to be able to allocate this money to, to different kinds of businesses, I think is really extraordinary. There was a question about who is administering it. We're in very close to being able to announce the administrator of the fund, who's a very well qualified economic development group. I think it's important that these funds be available as part of a toolbox to be coordinated with other sources of funding. And so we'll have a partner ready to announce. The legislation has not passed yet. We're very hopeful that that will happen this week. And as soon as that happens, we'll be ready to announce how folks can apply for funding. It's really kind of seen as something that will help businesses get reopened and put an immediate infusion of cash into these qualified businesses.
Great, thank you very much. Ed, anything else on your end?
Well, and Dr. Mullendorf, I don't know if you want to address there are some questions around other states, and as they open up, and our opening relies so much on testing, and how does that impact our planning for opening up, and are we allowing people in? I think there's some questions around that as well.
Yeah, so let's see. So in terms of, do we have enough, I'll try to address all these questions here. Do we have enough test kits? Yeah, so the labs have capacity. There are enough test kits, is what I'm hearing. It's a really interesting space to be in right now for me. And really just trying to mediate between the commercial labs and the providers on the ground. But yes, we are hearing that there are enough test kits. The issue is like some of our smaller healthcare providers maybe don't have adequate personal protective equipment, and are so, we need to kind of support them. And the emergency services staff are making sure, when they get requests for personal protective equipment, to link people to that. And so getting practices to learn from each other. We have some practices like family health centers have been very successful. MAHAC has been very successful. The Range Urgent Care and Mercy Urgent Care have been very successful in implementing ways of doing testing in a way that is safe and doesn't waste their personal protective equipment. And so really trying to encourage other providers to look at what they're doing and learn from that. But also, again, making sure they have everything they need to be able to do the testing successfully. So yeah, we do have enough test kits. Why do we need tons? So the thing is, we feel there are symptomatic people out there, right? There's symptomatic people who we told, if you have symptoms of mild illness, stay home, isolate at home, right? And so I feel like people have been following our guidance and have been doing that. Now we have to switch gears again and say, okay, now if you have symptoms, call your healthcare provider, as they now may be able to test you. If you don't have a healthcare provider and you can get to an urgent care, call Range, call Mercy. And then again, the people who don't have primary care providers and maybe can't afford to go to an urgent care, call us and we can connect you with MAHAC, who's willing to see people who are uninsured. Or that's where, again, the federally qualified health centers, if they're taking testing out to the community, linking people who have symptoms to testing is kind of my focus of this week. In terms of the other states and how, these are frequent discussions we have about, we put that quarantine in one of our orders about if you're coming from another state, and you're coming to Buncombe County, you need to quarantine yourself for 2 weeks after you get here, right? And so trying to figure this out as these other states loosen their restrictions, that's part of the plan and figuring it out. And I think it's not just our part of the plan, it's every county that has a border, and the entire state is trying to figure out how do we protect ourselves from what's happening around us. And so these are daily conversations we're having in our emergency operations center. And I don't necessarily have an answer for that beyond that, but we are trying to make sure that all the good work that we've done here doesn't get wasted by individuals and who are doing other things in other parts of the country. I think that's turnaround time for tests now, 24 hours. We're hearing for some 24, 48 hours is tending to be where we're going now. So that's good news. I think that was most of the.
Yeah, and I think there was a question around, are you partnering with the city of Asheville getting testing for those in the Housing Authority and at Harris Cherokee Center at the Civic Center?
Yeah, so again, well, I would say we've been, if anybody at any of our shelters, so the homeless shelters or at Harris, if anybody developed symptoms of COVID-19, we had a system in place with our homeless service providers where they could contact us and we would make sure the person got tested. So that's already been in place. And again, at this point, there's no recommendation and there's no thought about just going in and testing asymptomatic people yet. That will probably be coming after we make sure we've tested all the symptomatic individuals in the community. And we are, again, yeah, we Housing Authority, our community engagement team, City of Asheville, like first responders. Yeah, we're in conversation with them about getting testing out.
Great, and I just want to say thank you to all of our panelists this morning for giving of your time, of your thoughts, your insight, your input. I really appreciate you taking time to join us for the conversation. We're not going to be able to get to all of the questions because they're still coming in. Again, if we can try and do some research on the back end and put the answers out, we'll try and do that. Yeah, I think a couple of the questions really relied around either a specific industry or like outdoor recreation, or how do we get people to start going downtown? Can we get folks to patronize the businesses? Well, I think that is the unknown that we're dealing with right now, folks, and it's going to take some time. We certainly want to rely on the data and the healthcare professionals and experts. So as we slowly move into this plan and restart reopening, it's going to be on each of us to decide and to continue being safe, but also at the same time looking to start going back to some of the places we love. I know there's a few that are out there that are still doing takeout service for meals. That's one way to support them. There are others that you can shop online and do it that way. So I think it's going to take a collective effort from all of us to move forward with this. So again, thank you to our panelists, Stephanie, Kit, Jim, Libby, and Jennifer. I really appreciate you taking time to be with us. Just a few announcements, as I already mentioned, we are looking to host more of these breakfasts. We're looking to do the next one around May 14th. I'm really looking about how Asheville rises and maybe looking at resilience from the past and how do we leverage that as we move forward now. On May 28th, we're looking at doing one on finding opportunities in change, and particularly around leadership shifting mindsets and looking at opportunities. Second thing I want to announce is that we are taking applications for our next year's flagship program, Leadership Asheville Class 39. Those applications and all the information about the program are on our website at leadershipasheville.unca.edu. It is a challenging time for us as well because we certainly want to start that program in September. The dates are on the calendar that are on the website. We are hoping to stick to that as much as possible. And we need collaborative leaders now more than ever, both at our local level, at our state level, and at our federal level. This program is a great way to get connected to other people and to learn how to collaborate around community issues like this one. I certainly know it's been a challenging time for all of us, and I know I have friends who have lost their business and have shuttered their doors. The Buzz Breakfast Series has always been a major fundraising event for Leadership Asheville, and as a nonprofit, we could really use your support as well. If you enjoyed today's event and want to see more of these, please consider donating as we continue to offer these programs to our community. There is a link on our website to donate, and we really appreciate it if you're able to do that. Again, I want to thank our presenting sponsors, the Van Winkle Law Firm, all of our table sponsors, our sustaining sponsors, and community sponsors for helping us keep this program and these kinds of services that we offer to the community out there. Most of all, I want to thank all of you for joining us today. Thank you. Have a wonderful day. We'll see you soon.